Welcome to the Transition Bridge podcast. This is Debbie Ronka, and I'm so glad that you are here today. One of the most challenging transition for a woman is that season of menopause. It's one of those transitions in life that we know is coming and it can't be avoided. So we need to learn how to navigate through it in a healthy and a productive way. And it's for that very reason that I have invited a very special guest to be with us today. Dr. Ron Eaker is here to share his expertise on the subject of menopause. And I could promise you, you're going to walk away after listening to this episode with more insight and practical advice on how to navigate this difficult transition. Dr. Eaker is a double boarded in obstetrics. I'm going to say that line again. I don't know why I messed that up. Let me start again right there. Dr. Eaker is double boarded in obstetrics, gynecology, as well as bariatric medicine, and has been in private practice for over 35 years. He was awarded the National Focus on Patient Education Award by the American College of OB-Gyn for his innovative patient education program on menopause, and he has been listed in America's best doctors for over 10 years. He is a fellow of the American College of Obstetricians and Gynecologists and a clinical advisor to the American Running and Fitness Association. There's so many accomplishments that I could share with you about Dr. Ron Eaker. He's the author of Holy Hormones, Healthy Habits for a Fit Family, and most recently, A Woman's Guide to Hormone Health. And it's a book on everything menopause. His greatest joys are his wife of 33 years, Susan, and his two daughters, Katie and Caroline, and now his granddaughter, Ella Bess. And while he's not practicing medicine, writing, or speaking, he actually has run over 155 marathons around the globe. So we are definitely have a special guest with us today that has so much to offer, so much wisdom and insight. So, Dr. Eaker, it's an honor to have you with me today on the Transition Bridge podcast.
Thanks so much, Debbie. It's a joy to be with you.
Oh, this is great. Well, I know my audience is going to learn so much from you today. You know, menopause, truly, it's challenging. It's a challenging time in the life of a woman. And it's one of those transitions that comes with a lot of emotions and hormonal imbalance and all the body adjustments that we go through. So, I just love that you have a passion to help women in this area. So why don't you share with us how you got into this and how it is that you help women?
Well, it's an offshoot of being an obstetrician and gynecologist for a number of years. You know, women's health has always been a passion. It's always been something I've been interested in. And I really developed an interest in menopause a number of years ago when I began seeing more and more of my own patient population coming in with a lot of questions and a lot of questions that went unanswered. There was a lot of frustration, a lot of fear, a lot of anxiety. Women were very apprehensive about what they were seeing happening in their body, their emotions, and oftentimes it was very frustrating because the information that they were getting from other sources was either incomplete or unfortunately a lot of misinformation. So it began really trying to fill a need that I was seeing in my own patient population. And the more I got into the topic, the more I realized that there was a tremendous need for empirical, empathetic, compassionate, truthful information. You got to remember, this is not a new phenomenon, but a relatively new phenomenon as it relates to the culture. When we think about our average lifespan back at the turn of the century, even in the early part of the 1900s, many women didn't live till past the menopause time frame. So it was not something that really was much a part of their life. Yet once we started seeing lifespans extending in the 60s and the 70s and beyond, then there became much more of a need for information on this transition. You know, the average age in the country today is 51. But really, it wasn't until literally almost the 80s and sometimes early 90s that the topic was even brought up in polite conversation. It was not something that women talked about. And with the onset of some very important books, one by Gail Sheehy called Passages that came out, I believe, back in the 80s, it became okay to begin discussing the topic of menopause. And it really became a realization. I started in practice in 1988. So I, from early on, began to encounter a lot of women who were really wanting more information. They were willing to talk about it. They weren't able to get a lot of information from their own family members because they were still dealing with a generation where it wasn't discussed. There wasn't a lot of interaction in that topic between mothers and daughters, even at that stage. So that's really where the interest came. It was, how could I meet this need in my own patient population? And then it quickly became apparent that it wasn't just in Augusta, Georgia, that women were having problems with menopause. As you can tell from my accent, that I'm not from Brooklyn. I do practice in a medium-sized southern town, but I found very quickly that this was not only a national but an international issue. Once my book came out, I realized when I got numbers from Brazil that there was a need in a lot of countries that didn't have access to a lot of medical information, that this is a very broad cross-cultural phenomenon that is crying out for accurate, helpful, practical, scientifically valid information from a broad perspective, meaning that kind of a mind, body, spirit perspective that underlies really a lot of my approach.
I really appreciate your sharing that and it's so true. The generations before, it wasn't a topic that was discussed. And even recent generations, I would say my own mother and my grandmother, it was never a topic of conversation. And yet, when I experienced that in my own life, I could look back and now understand maybe why my mother acted the way she did, and maybe she didn't even understand. And
Well,
so,
it's so interesting that you brought that up, because what I found as part of the research, and I was somewhat on the tail end of this when I was talking with one of my mentors who had been in practice 20 years prior to me. He was telling me about how they used to have a diagnosis, a mental health diagnosis called involutional melancholy, that was actually a psychiatric diagnosis that turns out to be menopausal changes. So for many years during the early, I would say probably 40s, 50s, and even 60s, many women were actually diagnosed with a quote unquote mental disorder because they were experiencing changes associated with menopause. So you're exactly right. This has been an evolution in both culture and in our healthcare.
so let me ask you this. You were talking about, your patients coming in and they were having questions. You were realizing they were trying to understand. So, what are some of the myths or the falsehoods versus the truth of what women have been taught and what they need to know now?
I think probably the biggest myth is that this is a disease. Menopause is a normal natural transition. And unfortunately, what happened back in the 60s, when the pharmaceutical companies got a hold of hormone replacement, and particularly Premarin, the grandmother of all hormone replacement, of course, it was a medication. And what were medications used for? To treat diseases. So the only way to market this medication was to actively promote menopause as a disease state. Why would anybody use a medicine to treat a normal natural transition? So they used that logic, and unfortunately, even up until even probably in the 70s and 80s, many physicians were utilizing hormone replacement as a stay young and stay sexy pill. And that created this mindset that there was something wrong with a woman. There was a problem. This was not a normal, natural state. Well, nothing could be further from the truth. Now, that's not to say that this transition may not be fraught with a lot of bothersome symptoms, but it is a mindset that you have to embrace, that you're not broken. There's nothing wrong with you. This is a part of your physiology. There are a multitude of components that can influence how a woman progresses through this transition, but it's certainly not a disease. I think another big myth and big misperception is that it needs to be treated with a medication. Now, I am a big fan of using medicines in an appropriate setting, but that is not the only option. Many women feel in menopause, if they are going to address symptoms, that it's either medication or some other approach. It can't be both. It doesn't have to be either or. And it doesn't necessarily have to be a medication. It can be some lifestyle changes. I think that's the second thing that I wanted women to understand, is that they have options, they have choices. And most of those options and choices depend on their knowledge base. I kid people all the time saying MD does not stand for menopause director. It is, we are there as a partner. We are there as someone to guide you based on our experience, our knowledge, but you are the final decision maker in that. But you can only do that if you take that responsibility of educating yourself. And that was really what brought on the book and the online course, really was that attempt to satisfy that gap in knowledge so that women could partner with their healthcare provider and could explore those variety of options to treat those symptoms, not to treat a disease, but to address the symptoms. And I think that shift in mindset is probably one of the biggest changes that we've seen. Women are more encouraged today to embrace the transition. I love the quote from Margaret Mead, that the famous anthropologist, who said that the menopause can be a time of achievement. You can survive with postmenopausal zest. That was her term, and I love that. The people that talk about hot flashes being just power surges. So a lot of it is kind of mindset and how we approach the transition, understanding. And here's another myth that I think is very, very important for women to understand. The vast majority of women navigate this transition with minimal problems. That's something that surprises a lot of folks, because the old adage of the squeaky wheel gets the oil. If a woman's having a problem with menopause, they're going to tell 15 or 20 folks. If they breeze through it, it's not really a topic of discussion. So quite honestly, we get skewed in thinking that this transition for the majority of folks is going to be wrought with problems. Indeed, there can be some bothersome symptoms, but many women navigate through this time period and do quite well. So I also wanted to dispel the idea so that there wasn't this almost preconceived idea of expectation, because sometimes those expectations can be fulfilled. We understand the interaction between the mind and the body. And if we come into a scenario thinking, oh my gosh, this is going to be a nightmare. I've talked to my friends who are having terrible hot flashes, and their husbands are constantly on to them because of their decreased libido, and it just sounds like a horrible, horrible time. If that's their basis for establishing what the norm is, then they are more likely to actually accentuate any symptoms that may occur. So I want women to understand that the majority of folks really will do quite well. But that's not a limitation to say if problems do arise, there are a multitude of ways of addressing those.
I appreciate that you shared that. You just gave me a visual of, if what we hear is what we believe is going to happen to us, I can just see these fists clenched, like getting ready for this horrible thing that's going to happen when it may
Yeah,
be a totally different and unique experience to yourself. And that's one thing I find interesting is that every woman will have a different experience. And yes, we can find the common ground to support one another, but to also realize we're all going to have different experiences. And that's what I love your course and some of the questions that you have here, that you're teaching the women, like what are the natural and alternative ways to ease the menopausal symptoms? And I have another question tagged onto that. Can we, as women, do anything ahead of time, like you were talking about lifestyle and things like that, to maybe lessen some of those symptoms before they come?
absolutely. And that's a great question. And this whole idea of bioindividuality is gaining a lot of traction now as we learn more and more about things like the genome and the different genetic variations. We're learning more about the microbiome and the variations in gut bacteria and how one person's gut bacteria can be almost as precise as a fingerprint. Well, all that actually applies to menopause also. So, what Aunt Sally experienced is certainly not going to be similar to what you experienced necessarily. Now, again, you're exactly right. There are commonalities and we can make generalizations, but we are really quickly progressing into an era where we can look at the individual and design a transition time that is full of recommendations, whether it's lifestyle, whether it's supplements, whether it's medicines, that is specific to her individual situation. I very commonly will tell folks that I can have 10 women that I see in the same day going through the transition, and I'm going to have 10 different stories to hear.
Hmm.
And that's wonderful. And I think that's what keeps things interesting from a physician standpoint, because we're always looking for what is the nuance? What is the difference? How can we approach this and individualize it? And that's really most characterized by the options available for treatment. And again, let's just take, for example, something like hot flashes.
Mhm.
There are a variety of different options, and we can characterize these in different buckets. But there are lifestyle changes that can make a big difference there. For example, decreasing a lot of sugary, toxic foods that create a lot of inflammatory changes in the body, a lot of high glycemic carbohydrates, sugar foods. We know that fluctuation in sugar levels, for example, can influence the degree of hot flashes, sometimes
Hmm.
even trigger hot flashes. We know that certain foods can trigger hot flashes. Sometimes caffeine can do that, alcohol can do that, spicy herbs can do that. So that certainly is what I kind of call the first rung on the ladder, the treatment ladder, is you look at lifestyle. And that also applies to that first part of your question, is to what can you do as you anticipate being in that perimenopausal time frame, maybe the early to mid 40s. You're getting into that average range. You might begin experience some symptoms. When it comes down to prevention, what is beautiful about this symphony that our body is that if we do something that seems to be beneficial for one aspect, it generally is going to be beneficial for another aspect. For
Hmm.
example, if we're doing something that is beneficial for our cardiovascular health, like reducing our LDL cholesterol or improving triglycerides, exercising, uh, trying to get the proper sleep, doing stress management. All those things actually have been shown in clinical studies, again, to lower the incidence of something as granular as hot flashes. One of the most
Interesting.
interesting studies that I saw not long ago was looking at aerobic exercise and the frequency and intensity of hot flashes. And there was a marked decrease in both the intensity and frequency in people who were exercising on a regular basis. And not coincidentally, there is a positive correlation between women who have severe prolonged hot flashes and an increased risk for cardiovascular disease. So it
Oh,
just illustrates that there's this web, again, this interaction, this kind of like a mobile over a kid's crib. You all remember those where you pull
yeah.
the hippo and the cow moves. Well, you can't change that at all in the body. When you have something going on that affects one system, it's by its nature oftentimes going to affect other, and that includes the endocrine system, which is so intimately linked to a lot of the symptoms of menopause.
I love that you don't have a formula type approach. Every woman is unique and different. And it sounds like there's a holistic approach as well as a medical approach. There's so much that we could use to help our bodies. And so what are your thoughts about hormone replacement?
Yeah, that's a whole hour long podcast on itself, 2 or 3 hour long. Hormone. Well, let's start with the name. Uh, Hormone replacement indicates that we're putting something there that is supposed to be there and it's missing. Well, the reality is, after the menopause, estrogen levels are negligible. That's the normal. And we could spend time talking about hormone levels. That's another topic also. But the reality is, when we talk about using hormones in the menopause, they should be only viewed as a medication, just as you would use a medication for other symptoms and other problems. The same thing applies. So I want to kind of get away from that terminology, and I still use it. I still say
Hmm.
that because I've done it for the last 30 years, but I'm really making an effort to not call it hormone replacement and just say hormone therapy, because I think that subtle language imparts a change in attitude as to what we're truly doing. So that's the first thing. When I think about treating any symptom of menopause, I think about the rungs on the ladder. I already kind of mentioned that first rung, which
Hmm.
is the lifestyle changes. The second rung is the what many people would categorize as the natural supplements, and that's a buzzword that we could also go off in a rabbit hole on. But I would characterize those as supplements, herbal solutions, those types of things. And then the third category are where you get to more prescription medicines, whether they're hormones or other medicines that are not hormones that can be used to treat menopausal symptoms. Very rarely will I jump rungs and immediately
Hmm.
start someone on hormone therapy without exploring these other approaches first. However, there are also many good things with hormone therapy, and I truly believe that this is a case of misinformation in many instances. There was a cataclysmic shift in the approach to hormone use back in the mid uh, 2000s with the publication of the Women's Health Initiative, this big, massive study that looked at hormone use. And the headlines that we got were 26% increased risk of breast cancer, increased risk of blood clots, and almost overnight, 45 to 50% of people who were using hormones stopped. I
Hmm.
can remember in my own practice, it was weeks and weeks of phone calls and just questions non ceasing about this. And now that we have a bit of time and have gone back and reanalyzed a lot of that data, this massive study and its conclusions were largely misinterpreted, and I think were certainly misrepresented in the media. I think we now have a much better understanding of the true pros and cons of hormone use in menopause. So I would say, as a blanket statement, going back to that bioindividuality, is that there are some women who are greatly served and benefited in many different aspects, not only in symptom control, but in some cardiovascular benefits, in certainly bone health, even in some cognitive benefits, if the hormones are used appropriately in the right setting for the right periods of time. And again, that all goes back to the individual. You're exactly right. You cannot cookbook this. However, there are also many instances where the hormones are completely misused, they're inappropriate, and they create more problems than they solve. So it really takes a partnership between a woman exploring her past history, understanding her wants and needs. That's the first thing when I have a discussion with a woman about hormones. My first question is, what do you want to accomplish? What are you? What symptoms are you experiencing that are A, how prevalent are they? B, how bothersome are they?
Mm.
And then, have you looked at other options? So we really have a extended discussion, and it may turn out that with all that, hormones may be the best medication for her problem, but it is by far the only choice. And it really comes down to, is it the right choice for you individually?
That is great. I'll just share personally, I tried to use some estrogen years ago when I was in menopause, and honestly, my body was rejecting it. And it was like,
Yeah,
we don't want that estrogen. And so I just, I said, forget it. Like, there's a reason my body is depleted of this, and me trying to add it back in wasn't working well. And
yeah.
so,
It is your experience is not unusual, and I think the beauty of that is you listen to your body. You were
yes.
intuitive enough, introspective enough, and respectful enough of your own experience, and not afraid to express that, and embrace the idea that this may not be the best choice for you. I mean, just you think about it. If somebody had a particular an infection and they started on an antibiotic and they had horrible nausea and vomiting and diarrhea, well, you wouldn't think twice about stopping that antibiotic and looking for other options. Well, it may not be as pronounced with the hormones, but if you use the hormones and the treatment is worse than the problem, you gotta say something and you gotta understand there's a lot of other options. I think the biggest thing that bothers me is if a woman is, will use hormones as an example, and they have a problem and they stop them, but they then don't communicate that, and they go
Mm.
on suffering with the symptoms that we originally were using the hormones for, because they have this misperception that, well, if the hormones didn't work, I just have to live with this, and nothing could be farther from the truth. So I think it's critical that women understand that whether it's hormones or herbals or lifestyle, if you're not assessing where you are and where you want to be, and if it's not moving you in that direction, talk to whoever you're partnering with and working with and look at the choices. And sometimes that means the woman going in and saying, here are some other options. What do you think about this? Because unfortunately, there's a lot of family docs, OBGYNs, who maybe this is not their area of interest.
Mm.
There's a lot of OBGYNs, and I'm not throwing stones. I was there at one point in my career, who are focused on the obstetrics. And I have uh, colleagues that I've worked with over the years, and they've made comments that, they will gladly see 30 or 40 OB patients a day, but by golly, if one of those menopausal women come in, I just start crying because I don't want to deal with that. So what kind of help is that going to be to those folks?
None.
So it's one of those therapeutic relationships that I think is so important for a woman to understand that the doctor who delivered her babies, as she enters this menopausal transition, may not be the best choice to help her at this stage. So there's nothing wrong with having that discussion. Physicians who are comfortable in their own skin are going to be the first to understand that and are not going to be angry, or they're in fact, most of them are going to be, well, gosh, let me get you with somebody who likes dealing with these kind of things.
Exactly. Yeah, refer out. That's a great thing. So, is there, oh, I have two questions. So, I'd like to know what the time frame is for menopause. Is it so women will know if they're wondering if they haven't been there or if they're in the middle of it right now. Is this 5 years? Is this 2 years? How long is that? And then how do you help women with the emotional swings? I think besides the hot flashes, that emotional component is difficult.
Yeah, yeah. Well, let's talk about it with some terminology, because I think that might help knock down some of the misunderstandings about the semantics and the time frame surrounding. Menopause itself means going a full year without a period. So that diagnosis can only be made in retrospect. So technically, think of it as menopause is actually a point. It's a day. It's a day when you can say, okay, it has been a full year since I've had a period. That is menopause. The next day, you're postmenopause. Up until that point, you were premenopause. Now, that whole time frame, premenopause, postmenopause, many people will kind of consolidate and call perimenopause, or the time around the menopause. And the reason that term's important, because that really encompasses the time frame where most women will experience symptoms. And that's really what it's all about, after all. Most women are not too upset that their cycle stopped. I haven't had anybody come and ask me to bring it back.
True.
So yeah, it's all about the symptoms. So again, the average age for that point, that day where you look back and say, okay, it's been a year, is 51. Now it's a bell curve, meaning that there is about 50% of folks that are experiencing those changes in that time frame prior to 51, and there's some people on the upper end. So in general, if we were going to encompass about 90% of the population, we're probably looking at that 45 to 55 age range. That's when people will begin to see things like irregular cycles, vaginal dryness, mood and emotional changes, which you alluded to, skin and hair changes. I think in the book I may have listed 45 to 50 different potential symptoms, both physical and then what we would call emotional. So that kind of, and the other thing about symptoms, as we're talking about timeframes, is the majority of symptoms, as well as the intensity of the symptoms, seems to be targeted around that point. That's kind of the fulcrum. So most symptoms in general, after 3 or 4 years after that point where you're in that postmenopausal time frame, will tend to wane. Now that's average. There's still 40% of women who will have hot flashes and other changes in their 60s. So those symptoms can persist, but the majority of a lot of the both physical and emotional symptoms seem to be centered in about a 3 or 5 year time frame around when those periods cease. And that's because of the physiology. That's what happens is you see the estrogen begin to drop during that time. And in many instances, it's the drop of the estrogen, not the absolute level, but just that drop that is what triggers a lot of the symptoms. So yes, there is a lot of variation in the age. Generally, if those changes happen before 40, it's characterized as premature menopause, and that can be due to a variety of things that it range everywhere from chemotherapy to surgery to genetics. And then there's those very fortunate folks, and I say that sarcastically, who continue having cycles until they're mid to late 50s, although that's a very sliver of the population, and that still can be considered normal. But that's a general overview of the time frame, and why most people don't have to continue using whatever therapeutics they're using, including hormones, for the rest of your life. That's one of the questions I get oftentimes: if I start hormones, do I have to stay on them forever, or when can I come off of them? And again, that's based on this concept that most of the severity and the intensity and the frequency and the type of symptoms seem to be relatively limited for most women.
It's a great answer, because I know a lot of women wonder, how long will this be? And again, it's so individual, and it is a difficult time. So I absolutely want you to come back, because I know your book on healthy habits for a fit family is like a whole topic that I know my audience would love to hear about as well. So, in closing, can you give us a, an example of maybe a patient who has come with certain symptoms and how you helped her? And I know it's unique, but just to maybe give a before and after.
Sure. I actually saw a lady a couple of days ago who is in her, I think she was 49, and she had seen a couple of doctors because of some emotional changes that is similar to your previous question, because that is a very common symptom. And she had seen her family doctor, and the first thing that happened was she was prescribed Zoloft, which is a
Oh,
antidepressant medication, a
mm,
medicine that's commonly used for depression. And she was not getting much benefit. She was actually experiencing some side effects. And she came in, and just in the first 5 minutes of talking with her, it became obvious that there was much more going on than just emotional changes. That was certainly the predominant symptom that she was experiencing at the time. However, what she was also seeing was a huge disruption in her sleep. Some of that was secondary to being woken up with night sweats, but some of that was uh, things that she really couldn't explain. She was getting up more frequently and having to go to the bathroom and having trouble going back to sleep. She was waking up and having to change the bed sheets because she was
mhm.
sweating. She was also having some vaginal dryness, so intercourse had become painful. And that ended up manifesting in a conflict between her and her husband, because they were not communicating about that. And that raised a lot of miscommunications, and there was some stress and anxiety that was being placed on that. She was having some problems in her job. She was a successful businesswoman, but a lot of the mechanisms that she had used in the past that created that success were no longer being fruitful for her. She didn't understand that. She was having some foggy thinking, some difficulty concentrating. And it became very obvious that a lot of those symptoms certainly could be menopause related, but yet she was being labeled as someone with clinical depression. And it was a fairly easy call, because she was not getting better with the antidepressant. Actually was seeing a worsening of some of her symptoms, but she had not had really any evaluation of where she was from a hormonal standpoint. No one had ever asked her about her sleep. And so we looked at a variety of lifestyle changes. I don't ever like to make too many changes at once, because then you can't really assess what effect your therapeutics are having. I think that's a critical part of uh,
Mhm.
this approach. So I try to be very systematic, and it drives women crazy sometimes, because I stress the importance of patience. We live in a society where we want it yesterday, and
True.
that's not really amenable to this approach. But with patience, she was at a place where she was ready to commit to whatever it took to, as she put it, reclaim my life.
Mm.
So we luckily she was not on a high dose of the medication, so we were able to stop it relatively easily and instituted some lifestyle changes. We started talking about sleep hygiene and some ways of improving sleep. And in her particular case, we used a combination of some herbal solutions along with a little what we call transdermal estrogen, which is a topical estrogen
Mhm.
that has a little bit less in the way of side effects. And probably within 6 weeks, and again, I saw her just the other day, within 6 weeks, she gave me the best compliment that I could get. And that was, I feel like myself again. And
Oh,
that's what we were after. I wasn't trying to take her from the depths of depression up into a superwoman. I just wanted to get her back to where she felt herself, because she was a vibrant, successful, happy person that obviously was very well adapted to who she was, and she was just totally thrown off by this curveball of these hormone changes. And once we kind of balanced that back out, she was able to go back to those things that had been so positive and so beneficial up until that point. So that's just one example of how listening to someone, not labeling them immediately, and being able to look at each person as an individual can result in a very positive outcome.
that's a true gift, Dr. Eaker, especially to hear her say, I feel like myself again. Because when those emotions hit in a woman, you start second guessing yourself and you're trying to figure out what is going on with me. Why am I so different? And yet you can't put your finger on it. And sometimes we just take things that maybe mask the symptom, but you're not really getting to the root of it. And just the fact that you took time and you listened and you had other options, makes me really wonder how many people are on these antidepressants that are probably in menopause and don't need that. That was my one aha moment listening to you. It's something to really consider.
Sure.
So I know so many people would love to know, how do they get a hold of your books?
I believe they still may be on Amazon. I'm not sure. I haven't looked recently, but if they can't find it on all the online booksellers, they could email me directly, and I'd be happy to. You can put that in your show notes, and I'd be happy
Sure.
to make sure they knew where they could get a copy. My website is simply Ron Eaker. Dot, yeah, just roneaker.com.
Mhm.
And then if they're interested in uh, the online course, and that's a collection of videos that are very topical, they're very practical, they're designed for women who are looking for answers. They're not steeped in jargon and unintelligible medical speak. They're really meant like I'm sitting with you one on one talking about your situation. That was the model for putting this course together, and we address all the topics that are associated with menopause, such as decreased libido, lack of energy, weight gain. We talk about solutions to all those from this idea of mind, body, and spirit. And folks can get more information on the website Women's Online Wellness, just all one word, womensonlinewellness.com. And that'll take them to a page where they can begin to get some freebies. I've got a video up there on natural ways of getting rid of hot flashes. So we can give some folks some freebies just for showing up, to give them some information and help them to become a partner in the process.
Oh, that's a great encouragement. So, in closing, just thinking about any women that are listening right now, what words of encouragement do you have for that woman right now that is struggling in menopause?
Yeah, I think the best news is that there is hope. That's the one
Mhm.
word that I hear oftentimes is, I feel like I'm falling apart. I don't understand what's happening. I have the perspective of having walked down this path with countless women over the last 35 years. And the one thing that I take away from that is also having the ability to see them on that other side and see that there is hope, there are choices, there are options, there's solutions. The average woman's going to spend a third of her life in the menopausal time period. It is not a time to give up. It is not a time to just be satisfied. It's a time to grow. It's a time to expand that health span, which is letting a woman be in the best place she can be physically and emotionally to do what God has called her to do, to be the best she can be for herself and others. But she can't do that oftentimes alone. She needs a mentor. She needs a Yoda, if you will. She needs someone who has walked that path, knows the pitfalls, knows the options, and can partner with her, whether virtually or in person, to make this a time of celebration.
Well said. Well said. And I love that word hope because there's always another beginning. And I love your heart and your passion for helping women get through this transition and seeing them to the other side because they have so much left to live. And I love the quote that you used earlier about the menopausal zest. We need to be walking in that because we have so many things that we've been called to do in this world, our God-given gifts. And I just can't thank you enough for your humility, your ability, and your passion to help so many women find themselves again and go on with the rest of their lives. Dr. Eaker, I am so honored that you have been with us today. I've learned so much, and I really encourage everyone who's listening to please reach out to Dr. Eaker, get his books, get his course, reach out to him personally, and share this episode. All of us know a woman who's going through menopause or who eventually will be. And moms, you need to talk to your daughters. You need to start sharing this information so they're prepared. And so please use this episode and everything that Dr. Eaker has shared and connect with him. And I want to thank all of you for coming with me each and every week. You are the transition tribe. Each week you come in to embrace, to learn, and be transformed by the purpose and the power of the transitions that we are experiencing. And today was all about menopause. And women, we will get through this transition triumphantly because of all that we've learned through Dr. Eaker. Thank you for being with me, Dr. Eaker.
Thank you, Debbie. I appreciate what you do.
Ah, I love it. Thank you.